I came into fellowship with a strong interest in transplant psychiatry, and I really liked that rotation this year because I was able to work in the inpatient and outpatient settings and interact with patients being considered for or who have received heart, liver, lung, kidney transplants, or patients being considered for or who have received LVADs. And I feel like I grew so much during that rotation in terms of my medical knowledge, documentation, liaison skills, especially as it pertains to commenting on a patient's candidacy. And it was also a really neat way to integrate a lot of the psychotherapy skills I learned in residency to this very motivated patient population. And I think I took away so many skills that I will be able to apply in my career as an attending moving forward. I also enjoyed the ECT rotation. It was not only a chance to learn more about the background, mechanisms, history of ECT, but it was really nice because by the end of the rotation, I went to a place where I could actually evaluate a patient's candidacy for ECT, but go to the treatment room, know which medications should be administered to that patient and feel comfortable pivoting if something didn't go according to plan in the treatment room. And by the end of the rotation, you have 200, 300 ECT sessions under your belt, and you actually can get certified in leading ECT treatments in the future. So I thought that was a really cool opportunity to take advantage of in fellowship. I also did a child consult rotation earlier this year, and child consults was actually really helpful for me, even though I'm not going to be treating children in the future. I think during that rotation, I took away a lot of non-pharmacologic behavioral techniques that I could use to manage patients who have neurodevelopmental disorders, as well as patients who struggle with eating disorders and disordered eating. And these skills will definitely be applicable to adults in my practice moving forward. I also appreciated the chance to have supervising time on the inpatient settings at the university hospital and the VA. So I feel that in the role as junior attending, as a fellow, it was a little bit different than how I felt as a junior attending in residency, in that I was able to staff resident cases, but also get that direct feedback from my attending who's sitting right next to me about how I staffed the case. And throughout the rotation, I was able to pick up a lot of tips and tricks in terms of staffing cases efficiently and effectively. And that will definitely come in handy when I'm staffing resident cases in the coming months as an attending.